Works in Teagasc and Moore Park, has done tremendous work across a range of diseases, works very closely with us in Animal Health Ireland, and we really value the relationship. So Rena, would you give us your talk and then we'll have the Q&A.
I will. Good afternoon, everyone. So as Mike mentioned, I work with Teagasc. So that's the Irish Agriculture, Food and Development Authority, for those of you that wouldn't be that familiar with it. So essentially what I work in the area of herd health for these non-statutory diseases that Mike mentioned earlier. So that's why I have such a close relationship with Animal Health Ireland. So again, we try and coordinate the work, and I provide research data into Animal Health Ireland that they can base programs on. So again, what I was asked to do the same, and I think the previous speakers have really set up a beautiful focus for what I'm about to go through. And it's literally, they've shown you what can happen when you go into an expanding scenario, purchasing animals in, or even just expanding within your own capacity on the farm. But again, I literally go through 10 or 11 points that there are things to keep aware of, things that you should do when you're considering expanding, especially through purchasing. And at least it will give you a step-by-step guide as to what to do. And I literally try and point out the logic of why you're doing some of these things as we go through it. As you may notice, my own personal biosecurity is a disaster at the moment. I am sort of dying on my feet here, so I'll do my best to be as coherent as possible this afternoon and answer your questions in the best way that I can. So just to summarise herd expansion, and unfortunately a lot of the time that I speak with farmers, when they're talking about herd expansion, what they're looking at is the pros. I'm going to have more money, therefore now I'm going to have more milk. I'm going to have more cows, more milk, therefore more money. And again, that's the big focus, you know, business-driven, watching what expansion can do for the herd. The problem is a lot of the time we forget about the cons. Is because you have more cows, you've now got more disease risk. Invariably, there's less attention to health and welfare on the farm, be that young stock, your replacement stock, or the cows themselves. And again, all of those together will lead to less money coming into the farm. So now you've got this balancing trick going on between your pros and your cons to hopefully end up that you've got a profitable enterprise at the end of the whole thing. So why does it happen? Why could you end up with less money from this expansion? And why have you got a greater disease risk? So firstly, the easiest and quickest way for anybody to expand their herd is through purchasing stock. And again, as you heard from the previous speakers, purchasing stock does bring an enormous amount of disease risk onto your farm. One issue that we have in Ireland, probably not as much of an issue in the UK, is because we're increasing our herd size, and we may not necessarily be able to increase the land base that those cows are going to be on. So again, what we're finding is there's increased farm fragmentation. A lot of our farms are made up of multiple land parcels which are not necessarily adjacent to each other. I would also include into this contract heifer rearing. So where heifers are contracted out onto another farmer to rear them, put them in calf, deliver them back to you. Again, you've now got essentially groups, even though all your animals may be under your own herd number if they're on different land parcels of your own. They may be moved into somebody else's herd number if they're contract heifer rearing, but essentially they are being managed as completely different groups of animals. So even though you could consider them one unit, as in you own all of these animals, they're actually, depending on how many land parcels you have, you could end up with 3, 4, or 5 different groups that have all different disease status. And you need to literally look at them like that they are separate herds and separate entities in terms of disease. Also, when you're doing herd expansion, you are going to be introducing new management systems, whether that's new labour coming onto the farm, whether it's actually new sort of new practices coming onto the farm, and whether you have new infrastructure that you're bringing in. And I would certainly agree wholeheartedly that you need to have infrastructure in place or have very well planned what you're going to do with your existing infrastructure if you are increasing your herd size. It makes a huge, huge difference to have a plan in place for your infrastructure. So the diseases of relevance, obviously in terms of production diseases, and they're not ones that I'm going to deal with today, but these are diseases that you will deal with in an expanding herd. Obviously mastitis, and that can be purchased in, the same as any of the diseases that I'm going to talk about. Lameness, and again, you've got lameness, be it down to management or lameness from infectious causes. And then you've got your basic metabolic diseases, milk fever, displaced abomasum, ketosis, all of which are pretty much diet related. And again, that can come from changing your management infrastructure. You might decide to introduce a new feeding system, which may increase the prevalence of some of these diseases. Calf mortality, unfortunately, nearly always increases with increasing herd size. Now, not just because you're increasing the number of cows, the number of calves, and therefore you're getting increased mortality, your increased percentage of calf mortality a lot of the time tends to go up. Now, whether that's an Irish phenomenon or an international phenomenon is not clear, but definitely we do have it in Ireland, and we would have done surveys, both Dr. Emer Kennedy and myself in Teagasc, we've done quite a few surveys on nationally on dairy farmers here. And to be honest, some of the practices that we undertake in Ireland in terms of calf rearing are not ideal, in terms of pooling colostrum, incorrect dry cow management, overcrowding during calving. All of this is increasing disease risk for your calves. Now, most of the diseases that I am going to concentrate on today are diseases that you will purchase in and that tend not to be on your farm, but are so easy to purchase in unless you put a few precautions in place. So what we're talking about, there's two viruses, BVD and IBR. We've got bacterium there, Zoonoses disease, which is essentially TB's first cousin and as hard to track. One disease, a set of diseases really, that a lot of people forget about when they're purchasing animals is you can introduce new parasitic diseases onto your farm. It's very, very easy to introduce liver fluke onto your farm, and you may not ever have had it before. So if your cow's never had liver fluke, there's no liver fluke life cycle on your farm, but you purchase in animals, and if conditions are right in the soil for the life cycle to get completed, and these intermediate hosts are there, you can introduce quite significant issues in parasitic disease. And they often get forgotten about when purchasing animals. Salmonellosis, biggie, and a real biggie in Ireland, and it is spreading more and more. It used to always be considered a problem in Munster. So down southwest of Ireland was someplace you had to worry about salmonella. You could even know where a vet was practicing in the country by asking them how many cases of salmonella they saw on an annual basis. Literally, if you drew a line between Dublin and Galway, above it, you rarely came across a case of salmonella. Below it, it was just one of the standard diseases that you look for. That is changing. And we've now got, I would say, a very nice wildlife population infected with salmonella, which is carrying it around beautifully. And then, of course, lastly, you've got your infectious causes of lameness. So just to hone in then on the less money, and this is some work again, this is work that AHI would have carried out in conjunction with some of the group at the Scottish Agricultural College. BVD, and this, now, what I must stress, this is not disease outbreaks. This is on the basis of having bulk milk positive readings for these diseases. So again, it's just, has your herd been exposed to these particular diseases? You may not be seeing obvious clinical signs, and you may not be seeing, animals dying. But again, on the basis of research that we're after doing, and on the basis of some of the work that AHI are after doing based on Irish data, we have BVD, just general BVD circulating in a herd costing €63 per cow per year. IBR, some of the work I've done myself, we're finding at the moment, now we've further analysis to do on this, but our preliminary results are showing that there's a 250 kg loss in milk yield per cow per year if there's IBR circulating in the herd, and again, without obvious clinical signs. Salmonella was the one that gave us the biggest surprise. Out of all the diseases we looked at, it was the one that was causing most losses by it just being present on the farm. Again, no sign of clinical outbreaks on these farms. This is just basically that salmonella is on the farm doing its thing. Most of these losses related to milk yield losses. But again, you can be looking, now we looked at 3 or 4 different milk prices, and it was all based on a dairy systems model that we have in Moorpark. It's based on a 100 cow spring calving dairy herd. And the losses that we had from the production losses we showed up for salmonella, you're looking at losses of about €10,000 a year. And again, like I said, from just having salmonella on the farm. Vaccination will improve that considerably. Leptospirosis, not as bad, but still will have losses on the farm of about 1,200 per year. And neospora, as mentioned in that question earlier, we can go into more detail, again, about 1,200 per year. Not in an outbreak scenario. If you have outbreak scenarios for any of these diseases, these costs will significantly rise in that particular outbreak year. So how do you go about minimizing these losses while trying to expand and purchase in? So biosecurity has become the big buzzword of the past 4 or 5 years. And again, if you don't like a lot of people don't like the word, but literally all you're looking at doing is how do I minimize introducing disease onto my farm? And if I do introduce it onto my farm, how do I minimize the spread around the farm? That's as simple as biosecurity is. Don't make it any more complicated than that. It is about management practices, full stop. So one thing that is very important to remember about biosecurity, and again, we always tend to concentrate on buying disease in. One thing that you must always remember is your home herd can have diseases, and you can also buy naive animals into that sort of a scenario. So you've got this two-way system of disease spread going on. Diseases that are on your farm that you will give to new purchases, but also diseases from the new introductions that will be passed to your herd. Now, the easiest way to describe this is if you've got a home herd of 60 cows, and if you buy from 5 different sources, one source has BVD, another one has IBR, another one has Salmonella, another one has Neospora, and we'll say another one has Lepto. And your home farm, we'll say, has BVD anyway, or Zoonoses disease. And you suddenly bring all those groups of animals together. First off, you're going to get the stress of mixing all those animals together. Once that stress kicks in, that will increase the likelihood for any one of those diseases to start shedding. So you have now taken a group that had one particular disease and you've just exposed them to 4 more. And you've done that across the board for a range of diseases. And you will end up, unfortunately, like the nightmare scenario that you ended up in. And it is a nightmare scenario. I have helped out other farmers in the situation that you're in, and it's a lot of the time you have to sit and watch it happen and almost wear itself out. There are some of these diseases that once the outbreak starts, there isn't a whole hell of a pile you can do about it except stand and watch. So any preventative measures that you can put in place are always going to be cost effective. So have some sort of a biosecurity plan, and at an absolute minimum, you should have a good purchasing strategy. Anything that you do purchase, you must have a quarantine procedure, have your vaccination protocols in place, and I'm a big fan of what I call strategic vaccination. Don't blanket vaccinate everything. Find out what you need to vaccinate for. And that's on the basis of what's in your home herd and what you're buying in, and you vaccinate for the diseases you need to protect against across both sets. You also need very, very important and critical. Information is the key to decision making. You have got to do diagnostic testing. You will then identify what is going to be circulating in all these animals. Otherwise, you're taking a stab in the dark as to what you should or should not be protecting against. Diagnostic testing is always money well spent. So like I say, if you want effective disease control, just remember this triangle. You need to have some biosecurity practices in place. You need to have diagnostic information, and most valuable is on individual animals, but bulk milk testing in dairy herds is extremely useful. And then you cap it all off with vaccination to provide your protection. So, first thing you are going to do in any scenario is establish your own herd's disease status. You have got to do this. You cannot purchase animals into your own herd unless you know what diseases are circulating in your own herd to begin with. You want to check for BVD, IBR, Salmonella, Lepto, Zoonoses. I don't know, we have Salmonella twice, it's very important. Neospora. Again, don't forget the parasites. Dairy farmers, luckily enough, you've got the option of bulk milk testing, or you can do individual bloods, or you could do fecal samples. Now, we're very lucky in Ireland, like we have the Animal Health Ireland programmes, and we've also got the Irish Cattle Breeding Federation data recording systems that are allowing us to record more and more disease information. So again, I think all of our cooperatives, or most of them at this stage, will give Irish dairy farmers access into bulk milk testing for the majority of these diseases. In the UK, I know you'll have groups like NML providing something, a similar service, and it is well worth at least having, 3 or 4 tests, bulk milk tests a year to keep track of these diseases and that there are any changes. If you've already been doing that, you're going to know what your herd's health status is, and it makes life a whole lot easier. In terms of sourcing cattle then for purchase, buy from a single source if possible. And this is to minimise the difference, it'll minimise mixing, but it will also minimise the mixing of all different diseases from different sources. Different farms are always going to have different disease statuses. So again, if you can buy as many of your cattle from a single source as possible, it makes it much, much easier to get disease information from that herd. There's much less stress of mixing because these group of animals are used to being together anyway. You're getting this lovely history for the animals that you are buying. Now, for dairy farmers, I would be of the opinion that you really should not be buying from marts or auctions. If you can, always purchase direct from another farm. The biggest problem like that, if any of you go to a cattle market, you are essentially taking your cows out for a disease run for the day. I mean, that is literally, if you look at it, they've got 6 and 7 hours standing in pens in the same airspace, and whatever about some of the bacterial diseases, you will definitely, absolutely 100% guaranteed have BVD or IBR, those viruses floating around auctions. Now, it is becoming much, much better on the BVD front in Ireland in that there's no restricted movement on any animal that does not, that's either virus positive or doesn't have a status, which means BVD will be significantly reduced. But I would say I could probably find IBR, because stress kicks off IBR anyway. So the whole stress of transport, mixing animals, bringing them into an auction house, it's heaven for any of these viral diseases to get going. So buy direct from another farm if you possibly can. If you do need to go to auctions, there are now high health sales coming in, and this is animals need to be pre-tested for a range of diseases before they're actually allowed into the auction house. So again, it's just something to be very, very aware of. Getting a full history, and again, I think you've mentioned this in your talk, you talk to the seller, you request test results, previous health history, and importantly, their vaccination status. Now, one thing I would say about vaccination, and I'll probably mention this again, just because you get a vaccination status from somebody and he says, yes, all those cows are vaccinated for leptospirosis, you have no guarantee that number one, it was done, or number two, it was done properly, or number three, it was done at the right time of year. So again, I always treat new additions as unvaccinated animals. Now, it's handy to ask a seller what they've vaccinated their animals for, because then you know what they're keeping an eye out for. So, and that will give you some history on the herd. But I would always treat purchased animals as unvaccinated animals. Always speak directly with the seller's vet. You will need seller's permission for this, obviously, and some of the time, either your vet may find it easier to talk to their vet. And at least you'll get a clear history then. Your vet's going to know your farm, their vet is going to know their farm, and they'll see, look, is this a compatible mix of animals, or is it something that's going to create problems? And again, any test results that you do get, request a full interpretation. The only reason I put this in is I don't know how many farmers I sat down and go, yeah, but I got this test result report. And it's like, did you read it? It's amazing how many people, just because they've asked for the test results, they assume all those test results are negative. Not so. So again, and again, we're lucky enough with ICBF that definitely for BVD and now for Zoonoses, farmers are going to be able to print off test results for you very, very quickly if they're involved in these schemes. Quarantine is really, really important for introduced animals. Now, what we're talking about quarantine, and I know jaws start to drop when I start throwing out this quarantine definition, but if you want to prevent disease passing from one group of animals to another, you want at least 30 days in an area that is at least 3 metres from other cattle group, no sharing of feed and water troughs, and no mixing of dung and urine. And again, if you were buying from 5 different farms, you would want to quarantine those 5 different groups separately. Sounds like a nightmare. So this is where planning comes in. It is a nightmare trying to quarantine different groups of animals. Usually what I will tell people to do is buy during the summer. So it allows you at least use quarantine paddocks. In fairness, unless you've got a massive amount of housing and infrastructure, it is almost impossible, definitely, and I'd say the majority of Irish farms, to quarantine properly indoors. There's too much enclosed airspace. And again, when I'm talking about quarantining indoors, they cannot have shared airspace really either. So paddocks outdoors are absolutely ideal. And I would be of the opinion to purchase dry animals. Again, unless you've got 2 or 3 milking parlours, you are not going to be able to effectively introduce quarantine into milking parlours. You are going to have the same animals walking through the milking parlour, and therefore you're going to breach the quarantine. Now, one example that I will give is we purchased, and it was a bit of a biosecurity nightmare, what we did, but it was what we call the next generation herd in Teagasc in Dairygold in Kilworth. And essentially, we bought in calf heifers from over 80 different farms, so throughout buying from a single source. We were looking for specific animals that were of a particular genetic merit. So again, we ended up going to 80 different farms. How the blue blazes were we going to quarantine these? So what we decided to do is each of the animals, we actually introduced them into the farm and we put them into batches of 20. So at least if we had a disease outbreak in a group, all we were ever going to lose in terms of disease status was 20 animals. So again, we set up 5 quarantine paddocks and we literally just kept the animals in those batches. We did all our testing within the quarantine period. We had no disease outbreak inside any of those animals. I mean, it was absolutely incredible, the different sources that we brought them in for. Now, every animal that we purchased, and it might be a good one to go on to, hold on, we'll be coming to it in a while. Every animal we purchased was tested for a whole range of diseases. And again, it just meant we were able to rule out animals that we didn't want to get in, which minimised what diseases were going to get brought in the first place. But because we then had them quarantined, we were going to minimise, if there was an outbreak, we were going to really reduce the effect of that. That herd has now been established, so I think we're on year 3 at this stage, and we have yet to have any sort of a disease outbreak in that group. So, I mean, it really proved to me the value of biosecurity and quarantine protocols. Clean housing, important, and it's something that does get forgotten about sometimes. Just make sure that, any animals that you're purchasing in, and even your own animals, just keep the place clean and tidy. Hygiene is of critical importance for all your livestock, and it's actually something that gets underestimated on an awful lot of farms. Now, this was a study, I'm sorry if this is a bit hard to read, but bottom line, I went out to a group of international veterinary experts and we gave them a whole range of what we call these biosecurity or biocontainment diseases, all different things you can put in place on the farm to prevent disease spread. So maintaining a closed herd was probably, if you talk to any of us academics and even some vets out in practice, maintaining a closed herd is always top in terms of importance of preventing disease. It was interesting though when we compared, we then went out to a group of 120 Irish vets and we asked them to rank all these different measures, and they actually put down good hygiene as being the most important for disease protection. Now, I was kind of going, okay. Until the more and more farm visits that I do, you can be guaranteed if you walk onto a clean farm, there is minimal disease issues on that farm. Literally because it's a good indication that if there's good hygiene on the farm, they're probably doing all these other things pretty well as well. Interestingly, vaccination was not put top of the list. And the reason that it's not put top of the list is vaccination is a wonderful tool on a farm. But if you do not back it up with biosecurity and testing and give those vaccines a chance to work, they cannot work 100% of the time for you. You need to minimise disease risk to give those vaccines an optimal chance to work. And that would be more so in the case of BVD probably than anything else. Because we've BVD, persistently infected animals, the amount of virus that they shed on a daily basis can break down vaccines. So again, vaccination is extremely important, but you need to put a lot of these biosecurity things in place. Obviously, a farmer understanding of disease tells you the logic of why you need to have quarantine, why you need to do testing, how the disease spreads. Avoiding importation of slurry, you can bring in so many diseases, be they viral, bacterial or parasitic, they can all come in slurry. Quarantine for new animals, I've just gone through that. Veterinary advice, isolation of sick animals, absolutely critical. And one thing that we found, I'm not sure it's the same with our UK visitors, but Irish farmers, the isolation pen and the calving pen are one in the same. So just have a think about that and the logic behind it and see whether you're going to stay doing that. Now, Leptospirosis and Salmonellosis, the reason I have singled the two of these out is they're what we call Zoonoses. These can be passed to you. So not only do your cows have to worry about these, yourself, your kids, or any elderly on the farm in particular need to worry about these diseases too. I used to start off and literally kind of say, look, every farmer should be anyone with bovines on the farm should be vaccinating for leptospirosis. I have now, over the past 2 to 3 years, with the increasing salmonella that's happening in the country, I would add lepto and salmonella would always be top of my list on any dairy herd that's going vaccinating. Again, vaccinate all your new purchases and don't assume that the last guy did it properly. If they're naive animals, you need 2 injections because these are both dead vaccines that we have licensed. I'm not sure what's licensed in the UK. Here we've got Spirovac, Leptovite H for lepto, and we've got Bovivac S for salmonella. They're both dead vaccines, so you have to do 2 injections at an interval of 4 weeks and a single annual booster. So again, like I said, I've just singled those out because they are ones that you need to protect human health as well as animal health, and very, very important to do. And also for those of you with employees on your farm, you are duty bound to protect their health and safety from these diseases as well. Additional vaccinations then, you need to have a vaccination strategy, and the best person you sit down and talk to them about this is get your diagnostic test results together, sit down with your vet and decide what do I need to be vaccinating for on the farm. And again, that's the same for your home farm and any new introductions that you'll be bringing in. Now, this is something, and I put it in most presentations, is do not use vaccination as a replacement for good management or for testing. You will need to do all the other things, like I said, to give your vaccines a good chance to work. Now, I'll quickly, this is just a booklet that's going to be coming out from Teagasc. I'd say they're probably going to make a web version of it available for you, those of you from the UK. But essentially, we've gone through all the products that are licensed in Ireland. So you'll have the product, the dose, what site it gets given to, when it gets given, where it should be stored, what the primary vaccination protocol is, and boosters. They're the most important things you need for any vaccination, and it's amazing, and I'm guilty of it myself. You'll go into your little white piece of paper and you look for the dose and you'll forget about the rest of these. If you're going to spend the money on vaccination, and there's a fortune spent on vaccines every year, make sure that you're using them properly. Inside in that booklet then there'll just be a quick vaccination planner, and like I said, there's a dairy version of this coming out. It will be given out at Teagasc roadshows over the next few weeks, and again it probably should be available on the website as well. Bulls, again, if you have breeding bulls on the farm, BVD virus, if they're positive, they're gone. They are no good to you. You do not want them on the farm. Just get rid of them. IBR virus exposure, same thing. Now, again, especially if you're an IBR-free farm, you cannot have a bull with IBR virus if they are antibody positive. So if there's any suggestion that they've been exposed to IBR, and if you've no IBR in your herd, off the farm. And again, either test them before purchase or while in quarantine. Ideally, you can do both because animals can become infected in transit. So again, look, the rest of that kind of stands to reason. Females, you're doing the same, BVD and IBR. But if it's economically feasible, and this is what we did in Teagasc, we tested for lepto, Zoonoses disease, Salmonella, neosporosis, and again, ask your vet, what diseases do I need to worry about in the area, or I'm buying from up the country. Now, obviously, I'm not dealing with the statutory diseases here, so you're going to have your regulatory requirements for TB, brucellosis, and whatever else. For BVD, always remember, if you are buying a pregnant heifer or a cow, you are buying 2 animals. You can have a test result for one of those animals, but the calf that is in utero, you cannot test until it's born. So that animal needs to be tested. That is the best way. It's probably the most efficient way of introducing BVD onto your farm, and I would say probably the way that most people purchase BVD onto their farm. Buy a pregnant animal, they'll test the pregnant animal for BVD virus, pregnant animal is clear, and they forget to test the calf. You have got to test the calf. And again, these are called Trojan cows, if you ever hear your vets or other farmers talking about them. Again, really easy way to bring BVD on the farm, and it is something that's still occurring in Ireland, even with the BVD programme. Parasites, here's your liver fluke, you've got lungworm, there's rumen fluke, and you've also got your gutworms. You want to dose all new introductions. Now, my own personal choices is I prefer ivermectin doses to go in. I think they'll do endoparasites and ectoparasites for you, and they'll also do lungworms pretty effectively. For fluke, you want a good fluticide. Now, again, there are differences between Ireland and the UK in terms of licensed medicines. We're very, very restricted in Ireland. You can use some triclobendazole products, but only over the dry period. You can use albendazole products and oxyclosinide products, and that's it. That's all you can use in Ireland that's licensed. And again, be careful to observe your withdrawals. Don't forget about lameness, and footbath all the animals when they come in. If the animals look like they've healthy feet and there are no lesions, a visual inspection on feet is one of the best things you can do first. So you're looking for, no sores around the end of the feet, which would indicate either BVD, or you could get Mortellaro, digital dermatitis. Do not buy those animals in. I mean, this stuff will spread. Mortellaro, if it gets onto a farm, is flipping hard to get rid of. You can use formalin footbaths. There are issues about formalin, and that's a carcinogen for humans. The only advantage to it is once it meets organic material, it dissolves back down into carbon dioxide and water. So it's dangerous to begin with and turns into very safe spin-off products. You can also just use your copper sulfate type products, which again, there have been issues on some farms putting waste from that into slurry pits. They then go out in the land and they've had issues with copper toxicity. So just watch what product you decide to do. But very quickly, you can just run them through a footbath and you'll hopefully knock out those. Continuous monitoring, obviously, and strategic vaccination, and keep your vet involved in all of this, and keep your data, you want nice, filed, coherent data that you can put your hands on relatively quickly. The only reason I put this at the end is we have had an absolutely nightmare year in Ireland in terms of farm safety last year. And what focused my mind is I got attacked by a limousine cow the week before last on a farm when I was out sampling. So again, I was doing everything in what I would consider was I was doing everything safe practice, doing all my animal handling right. The farmer did nothing wrong, I did nothing wrong, and I still got caught. So again, just look, that's my final message, try and farm safely. So that's me.
Okay, ladies and gentlemen, we've had a terrific presentation. Please, attention, please. Rena, for a virally challenged presenter, did very, very well. So, questions for Rena, and then we'll open up for both presenters. Any questions directly for Rena first?
Scared everyone.
Yep, Mike.
It might make good economic sense, but is it a lot safer to buy an animal well away from calving?
Try again.
It might not make economic sense, we'll say, at other levels, but just safety. The further away you buy an animal from calving, 6 months, 9 months, 12 months, 15 months.
What I wouldn't say is the furthest away from calving, because you can still end up buying a PI that way. Bottom line, the safest animal to buy is an animal that's not in calf. So again, you're looking at maiden heifers. If they're in calf, even if they're the nightmare scenario for BVD is even if they're 6 or 7 months prior to calving, that's when the PIs are generated. So you could still actually end up with a nightmare scenario then. But yeah, probably maiden heifers, they're the ones, they tend to be negative for IBR for some reason. We don't know why, but younger animals tend to be able to avoid IBR. So you're almost guaranteed they'll be negative for IBR. You're going to avoid any issues with Trojans and BVD. Zoonoses is a difficult one because they're too young to test and get a proper reading from. Neospora would be okay. You'll be able to check them for that. What else is there? Lepto and Salmonella, just vaccinate. So again, maiden heifers are probably one of the safest animals you can buy.
Okay, over here.
With reference to the Salmonella vaccine, if you've got a herd showing symptoms of Salmonella but vaccinating at calving, is there any merits to considering moving the vaccination to the autumn? When is the best time to vaccinate?
Now,
and can you transition it from one period to the next?
What I would say about vaccination, and this is only on the basis of the recent, well, it's not as recent as it used to be, 2009 work that we did. Common practice in Ireland, if you've got a spring calving herd, which 85% of our herds are in Ireland, so if it's a spring calving herd, what you are looking to do, you've got two things that you want to protect against for Salmonella. Number one, you're protecting against abortion. And in a spring calving herd that your breeding season is, end of April, May, June, your abortions can start happening as early as August. So August, September, October, November are probably your risk months for Salmonella. So most farmers in Ireland, if they're vaccinating for Salmonella and they're looking to avoid abortions, they will be vaccinating sometime in September. We in Teagasc have had to pull our vaccination back to August because our abortions started happening earlier 2 years ago, and that's why I'm saying Salmonella does seem to be getting worse and more virulent. So we'll just say kind of autumn for abortions. But then when you're looking at calf health, it's a different scenario altogether. It's the same bug that's causing the problem, but you're looking to protect a different animal, as in you're looking to inject the cow to protect the calf. And in that, I would recommend going in, again, if it's a spring calving herd, you would be going in December, January to try and protect the calves and make sure that they get passive transfer. We have found on farms, Salmonella positive farms that were vaccinating for Salmonella, even though their abortion levels were fine, they did have higher calf mortality rates in the first 6 weeks of life. So it looks like that those herds that have both abortion issues and calf health issues should actually be vaccinating twice a year for Salmonella. Anyone who's only looking to either protect the calf health or protect against abortions, autumn for the abortions, and probably late December, January for protecting her against the calf score.
Okay, and just before we go to another question, we'll take the Neospora, a bit more on the Neospora question earlier.
Literally Neospora, and like I said, I was surprised that we got any cost of it outside of an outbreak scenario, but as you can see from our figures there, that we were finding losses on farms of €1,200, just the fact that Neospora was on the farm. And most of that is going to be down to infertility and the sporadic abortions. Any cow that's positive for Neospora, she won't abort every year, but she's at much higher risk of abortion than a negative cow will say that you have in the herd. Once a cow is infected with Neospora, they are infected for life. Full stop. You can't do anything about it. You can't vaccinate. Now, if you look up the internet, you will find that there's a vaccine in the US. From all accounts, buy it if you want. Well, no, it's illegal to buy it and bring it in, but literally, it's not any good. It doesn't prove effective even in the US. for neospore, and literally I'm only after dealing with a farmer who's dealing with a neospore outbreak, pretty similar to the person who asked the question earlier. He's got dealing with, I think, 35 empty cows at this point in time. 18 of those had just straight aborted that he caught. Literally had rented some new land. That land obviously was contaminated with neospora. He didn't get a chance to reseed it or anything, just moved animals onto this new land and ended up with, a massive abortion storm. And it is expensive. One of the biggest problems with it is your abortions tend to occur kind of mid-gestation. So there's no chance that those animals will come into milk. So you've essentially, whatever cow has aborted, she's gone for you for the following lactation. So you've now lost her lactation, her milk production, you've lost whatever calf she was carrying. And essentially, those animals are no good to you for producing replacement heifers. Every animal out of those that they produce will also be neospora positive. You can take it in 95% of cases. You cannot use those animals to breed replacement heifers from, or you will just breed neospora into the herd. So yeah, it is. The prevalence figures we have in Ireland, there's about 20% of dairy herds that we found were positive for it, but they've all had abortion storms and they have suffered from it. I mean, it's amazing how many farmers I still meet that don't know what it is. But you'll know what it is if it comes onto your farm. You will get fox, sorry, keeping going. But the dogs and foxes are what you're protecting against. One of the biggest culprits we found in Ireland were greyhounds. Now, again, I have no research proof on this, and I don't have a lot of big research studies, but literally any farm that we've gone on to investigating, greyhounds, on the majority of them, there was either greyhounds on the farm, there were people walking greyhounds on the farm. Now, whether it's just that there are so many greyhounds produced in the country and, they're walked a lot on farmland, that could be just a risk. But again, if your herd ends up being positive for neospora, you have got to prevent your herd reinfecting back the fox population. If you do, you've now got neospora in your wild fox population around your farm, and it's very, very difficult to stop that keep coming onto your herd.
Okay, one at the back there, and then Jan.
Thank you. Tony Evans, I was an amateur consultant, and after the quality of the speakers today, I'm now very amateur. I have a question for both speakers, please, but particularly starting with Andrew and Claire. Andrew and Claire, you are now once a day milking, I believe. I'm sitting next to a guy who also is once a day milking, and I'm just wondering about level of resistance in animals that are on once a day versus twice a day. Anything to say? And Rena, any comment to that as well, please?
Okay.
Once a day probably reduces stress levels for everybody, cows, people. And if anything, stress causes disease. So it's de-stressing systems. And once a day's helped us do that and allowed us to grow our herd numbers as well.
So a positive correlation. Rena, can you back that up?
No, I'm not sure if John Roach is in the audience, but we had a discussion on this last week about another presentation that's going to be given. All I would have would say I've no research evidence. What I would have is just anecdotal evidence from farmers that certainly are doing once a day milking, or even once a day milking in, we'll say, heifers that might not be in great body condition score after calving or something like that. They do seem very, very happy with their decision to go to once a day milking. Like I said, I'm not aware of any research. It's a very difficult research question to answer because it's so hard to track some of these diseases. But I think just on a physiological basis, you are going to be putting less stress on the animals, and seeing as how a lot of these diseases get kicked off by stress, it must be some sort of an advantage.
Does your question imply positive or negative correlation? Positive,
Positive,
good.
yeah.
Jan?
On the subject of BDD, after 3 years clear testing, does testing stop and does vaccination become compulsory? Or?
Going to leave you
Is
answer
that
that,
for,
right?
who's that for? The original idea was that we would have 3 years, we'd have the pilot program, and then we'd have 3 years of national compulsory testing, and that hopefully we'd have the disease down to under 0.1% incidence, at which stage the viral cycle would be sufficiently broken to be able to go to vaccination, probably in consultation with your vet, and some may choose not to vaccinate. But it wouldn't be compulsory vaccination at that stage. It would be under advisement from your vet. Unfortunately, the number of PIs retained has meant that there's another year of tissue sampling, And the incidence at the moment is about 0.32 or 0.33. And we're hoping that this year's sampling will get it down to around 0.1%. And at that stage, we should be able to have a national discussion about advising people to move to a vaccination program in consultation with their vet. And some, may, as I said, may choose not to. I would certainly not advise, and I'm going to ask Rena to comment from a technical perspective. From what I hear, I would not advise anybody to stop vaccinating yet. If they're currently vaccinating, certainly don't stop. What we're doing, we're not stopping yet on our farm. We've had no PIs, but we're not stopping until the national instance is down to a level where it's advisable to at least consider stopping. So maybe you can, and then quite happy to take a reaction back from you as to what we need to be doing as on a national program, because we're at a critical stage.
In terms of BVD vaccination, we're actually in, because of PI retention, we've got ourselves in the unfortunate situation that we are creating naive herds through the vaccination scheme, or through the eradication scheme, but we're keeping a source of virus on certain herds. It has probably never been more important for farmers to vaccinate. And again, I know a lot of people that would have heard me speak. I'm always into strategically vaccinating if you have to vaccinate. But I think BVD, while we still have that source of virus on and we're creating naive herds, remember we had 98, 99% of definitely dairy herds, and probably the same in beef herds. They were nearly all immune because they had met natural exposure to BVD. We're reducing that natural exposure, but we're keeping a source of virus. So we have got to supplement with vaccination in the short term. It is disappointing that these PIs are being kept in the country because it is. Now, vaccination isn't the be-all and end-all for BVD. You need to try and stop it coming across the ditch onto your farm, and you definitely do not want to buy it in. But I think vaccination for BVD is vastly more important even in the last 2 years than it was in the 10 or 15 years before that.
Okay, yeah, one down there.
Question for Rena. A closed herd. What's the most efficient way of finding out your neospora and Zoonoses situation in the herd?
Now, the quickest way for neospora is you can do a bulk milk. There is quite, I've done a lot of bulk milk testing now for neospora, and the test that's being used by most of the cooperatives in Ireland and any of the private labs, it's pretty spot on from what I can see. Now, if you are going to do bulk milk testing and if you've got a spring calving herd, I'll deal with spring calving herd first. The best time to test is somewhere in the autumn. So you will be, if you're still milking in November, that's the best time to take the sample. Pretty much because most of your cows will show up being positive when they're actually carrying an infected calf in utero. So again, you're looking at about 7 months gestation that you want to test the herd. So sometime October, November is the best time to do your bulk milk. So that's the most efficient way to do neospora. Unfortunately, Zoonoses isn't as efficient. You have to do individual animal testing for Zoonoses. You cannot do bulk testing for Zoonoses. You could be almost guaranteed you'll get a negative result, and it doesn't mean anything. So again, you need to do either individual bloods or milks. And again, the scheme that's going by AHI at the moment, you can do individual bloods annually, or you do 2 milks a year, which can be done through your milk recording samples. But you need to make sure you have a test result for every animal over 2 years of age in the herd. Closed herd helps for Zoonoses. Closed herd will help for neospora, but you've also got to remember there's a wildlife reservoir for neospora, so a closed herd isn't always the guarantee against neospora. It can come in, like I said, either neighbours' dogs coming in or foxes in the area. Does that answer the question? Or perfect.
Yeah, okay, there's one over here.
This is a question about naive cows with regards to BVD. If they are vaccinated just once in their life, are they then no longer naive?
If they're vaccinated just once in their life, that will not, you literally take it that has to be annually boosted. If they're not annually boosted, you can take it that the following year that animal is essentially naive.
Okay, one at the back. No? Okay, I thought there was, yeah. Here.
Hello, Riona, Brian McCracken. What's your action plan on the traffic light results from a cow, individual milk sample or blood samples?
This
please?
is for Zoonoses, is it? Or
Yeah.
yeah. Now, again, what I'll go through is what we do in Moorpark. It's probably the easiest way of doing it. And literally, we were extremely strict in what we were doing last year. We did have some ELISA positives that we were looking to clear out of the herd, and look, we decided to go, we're going to be super strict. So we implemented the traffic light system. And what we also did within the traffic lights is we had...
Maybe a very quick explanation of what traffic light system is.
So this is, if you've got, what you're trying to do is assign your cow's risk in terms of Zoonoses. So if you've done a test on them, any cow that has never given you a test positive, be it ELISA, culture positive or whatever, she's never given you, or she's never had any sort of clinical signs, you'll give her a green light. Any animal that may have given you one test positive, so there's a possibility it might have been a false positive, she's no clinical signs, she's, you might have done 5 or 6 other tests on her and she's never produced another positive test, you might give her the, an amber light, as in, I don't think she, there's a question mark about her. The third one then is when you get multiple positive results on an animal, you are looking that those animals are high risk on the farm. Now, you will notice I'm not calling these positive and negatives. I'm calling these low risk, moderate risk, and high risk. That's the best we can do with Zoonoses, with the diagnostics that we have. But at least it gives you a way to manage your herd. So, like I said, what we did in Moore Park, we actually split our red cows into red plus, reds, and red minuses based on different risk. We also were looking at results around TB testing as well. So because we were being so strict, any animal that showed up positive after TB testing, we gave them an amber. Now, we've since revised that back for this year. We're ignoring any animals after TB testing. For about 80 days after TB testing, we're ignoring those test results. And then green, any animal that never ever gave us a positive test result. So greens are the ones you want to store colostrum for. These are your colostrum source for all the calves in the herd. Ambers, if you're stuck, and if the calf, if the dam ends up suckling her own calf, not the end of the universe. The reds are the ones you really need to watch. This is where all your calf management comes in. You want to snatch calf. You want to make sure that there's massive hygiene around those cows. They do not get calved in the presence of other cows. Their fecal material definitely does not come in contact with other calves. Like I said, we did things like if there was a calf born inside in the slats, so obviously we have no idea what fecal material or what cow they came in contact with. That calf was also automatically designated red as well. So we went overboard on identifying and categorising cows literally on the basis of management. Mick, who I see in the front, I think here, came up with a brilliant idea for us then, that we actually split our heifer calves and our bull calves. All our bull calves went to one farm and all the heifer calves stayed on another farm. We had 2 different farms that we could use that way. For the heifer calves, they all got their own dam's colostrum, except for the red cows, again, who were snatched. The calves were snatched and they got colostrum from a negative dam. Because they were from positive dams, they've also been ear tagged. We've just ear tagged them red just to keep an eye on them for their lifetime. All I would say is calf management is probably the most important thing that you can do, and what you're categorising your cows from. Because you want a clean source of colostrum, you want to prevent any dung from these potentially high-risk animals getting anywhere near your calf source. And again, you may look at the heifers from red cows in particular. Are you going to keep them for breeding? Are there animals that you want to keep on the farm? And again, any red cows either do fecal PCR or fecal culture, trying to get a definitive status on them. But like I said, I cannot stress calf management enough. It has made a phenomenal difference to us in Moore Park. It really, really has.
Pilot results early results on the pilot program that we're running in AHI is of the 1,400 herds in. Incidence is lower than international incidence, but higher than what we had expected. I don't want to go into too many definitive figures because they're very preliminary results, but we had expected low 20s incidence, we're into the low 30s. We think there's a bias because the people that knew they had a problem went into the pilot program, so we think there's a moderate bias there, but we need more information. We want to grow that pilot program to at least 2,000 herds in this year. We're continuing with the support from both the state and the individual milk processor, and obviously the farmer bears a considerable cost as well. But the other good side of it is the incidence within herds is low. There's only 1 or 2 or 3 cows within most herds that have high readings. So good and bad in it, but the critical thing is that we have at least some element of a national program. Our dependence on baby food formula, for example, is huge internationally, and if there was ever a link made between Zoonoses and human health, that industry would come under extraordinary stress. So it's critical that we have one. those of you that think the test is inadequate, you're right, it is inadequate. But equally, it is more important to have some element of where we're at nationally than to ignore it. The only thing worse than having poor tests is having nothing. All of you that aren't in a program know less than the people who are in a program. So I just would advise, help us through this, support us. I don't envisage any element of compulsion unless that link is ever proven conclusively. But I am advising us as an industry that it would behoves us to ensure that we're doing something about this because it is of national significance, and it's something that we have to continue to work on.
One last thing I would say on that is a lot of people don't see the cost benefit of doing a lot of, like, there is a lot of extra labour involved in the calf management you need to put in place, and it can be difficult in your own head to justify that. All that I would say is in Moore Park, Curtains and all our farms that we've put what we would have started being Zoonoses control programs in place, the calf health across the farm has just improved no end. So you will get additional benefits in terms of overall calf health from trying to control Zoonoses. We are just gobsmacked. Calf health has gone from being something that we always need to be wary of and watching our vaccinations and everything to almost, I know Emer Kennedy now, the calving season is not the big deal that it used to be. It's very busy, but she's not trying to deal with sick calves anymore.
So just to put you going home later on today on a good note, there's only about 5 or 6 external parasites. You have to worry about 6 or 7 internal parasites, 8 or 9 or 10 viral and bacterial challenges that you have to worry about, and a lot of other things. So it really is a piece of cake. This herd health thing is a piece of cake. We had a tremendously open and honest presentation from Claire and Andrew, and I really want to give them a round of applause. I hate being on a platform with Rena. She always woos the audience, and she did it again today. Rena, well done. Congratulations. So Mike Murphy, before we break for coffee, Mike has a short presentation to do. As you know, he rewards some outstanding performer from the previous year. But I want to, just before I finish, recognise that the talk about the grass on our farm is not due to me, it's due to my son. So I want to acknowledge him as the outstanding performer on our. So any of you that don't make, it's him that does it and not me. So I had to come clean on it before you gave me the credit. So Mike.
Thanks, Chairman. Ladies and gentlemen, the value and the quality of any conference, it's totally down to the quality of the speakers. And frankly, I'm in awe of the integrity and the intelligence and the amount of preparation our speakers put in. And with if it's a good conference, it's really down to them. So we love to celebrate them. We love the idea of an annual award, the Paddy O'Keefe Award, we'll say. And as well as honouring the speaker, all our speakers, by the way, all our speakers, we are also celebrating the legacy of that marvellous man, will say that, and Paddy will say that, and I think in a way he would have liked, in the sense he's celebrating, if you like, the generation of knowledge, the sharing of knowledge, the enterprise, will say, the intelligence, will say, progress, will say that, and if you like, the whole idea of living, exploring and expanding your potential and everything else like that. So the winner of the last award will say that and by the way, it is not as judged by us, it is entirely as judged by the audience based on your feedback sheets. We really analyse the feedback sheets, we'll say that, and again, the value of the conference, it's very much down to the feedback. So I just ask you to take the feedback sheet seriously. We do, but we just like to run a small video because we'll say, for reasons of circumstances, we can't actually quite make an award today. So we have a video of about 2 minutes.
Okay.
Ladies and gentlemen, it's a great pleasure to be here in Fairlie, New Zealand today. In the last conference, we initiated an award, Paddy O'Keefe Award, for excellence in terms of celebrating the best speaker. And we were trying to capture, if you like, some of the ethos of Paddy, we'll say, where he was so absolutely timeless and unsparing in his efforts on behalf of Irish farmers in terms of generating more knowledge, which added greatly to the prosperity and dignity of Irish farming families. And the reason why I'm presenting it in New Zealand is because we said that Leonie Guiney was magnificent at the last conference, was judged by you, the audience, as our best speaker. So Leonie, it gives me great pleasure to present this award to you, because I think you're very much the same ethos as Eddie. So thanks very much and congratulations.
It's a great honour to receive anything with Paddy O'Keefe's, to in fact be compared to Paddy O'Keefe is a huge honour, and I thank you so very much. To me, the words Paddy coined for the Irish Farmers Journal, fearlessly on the farmer's side, sums Paddy up completely, and he absolutely inspired me in my time in Ireland. If I could contribute 1/10 to New Zealand or Irish farmers of what Paddy O'Keefe achieved for Irish farmers, I'd be very satisfied. So I just want to say thank you so very much. I thoroughly enjoyed my time at the conference, and it's a fact that I learned so much more from Ireland than I ever gave, so I want to thank you for that time as well. Thank you.
And just finally, on behalf of Leonie's many friends in Ireland and the UK, I'd just like to congratulate her on her very first effort at getting elected to the board of Fonterra. Very well done, and I'm sure we'll say that you'll be an adornment to the board.
Okay, well, we'll take a 5-minute break now while we're setting up the next session. So if you need to go to the toilet or make a call or just stretch. And then the tea will be served at 5:45 as you go home. There'll be tea, coffee, sandwiches, and goujons, because we know a lot of people have traveled a long distances to come here today. So we'll just take that 5-minute break just to set up this session and for you to take a bit of a stretch. Thank you.